Hey guys, I'm Sebastian. I'm going to cover the sports hernia diagnosis today that you've probably been looking all over the internet for. I know it's hard to find good information on sports hernia diagnosis, but I'm going to lay most of it out for you here. I'll try to keep it outlined, but at the same time, there's a lot of wishy-washiness in my opinion about it, and I think there's a lot of throwing around of the diagnosis, which is not necessarily merited. It's overly diagnosed in many cases. So I'm just going to give you some thought-provoking things as well too. I'm not necessarily going to go over exercise and stretching and rehabilitation today. I will talk about it, but we do have other videos on our site, which you can go to the little link, the little circle red, or something might pop up that says subscribe to the channel. I really do mean subscribe to the channel. I'm putting a bunch of these sports hernia videos out because I see that there's not adequate information out there about it. So if you want them when they come out, subscribe to the channel, turn on your notifications, or use the search bar if you're late to the game here. Now, the sports hernia, generally speaking, it can have multiple different AKAs. We have sportsman's hernia, we have Gilmore's groin, we have athletic pubalgia, which basically means athletic person's pubic pain. The thing that I want you guys to consider here is that it's usually on one side, it's not on two sides. Some of the men will have some testicular tightness, they call it. So tightness of the testicles. It's really odd feeling. And I met a lot of patients with this. They don't quite know what to make of it. Sometimes people have low back pain associated with the groin pain or the symptoms that kind of surround the sports hernia. Sometimes into the outer hip area. I'll point at all these on myself, by the way. And sometimes down into the thigh. Now, I want to challenge you again, just as a thought-provoking thing, is that if you have lower back pain or tightness, addressing the groin pain probably starts from the back, and I'll explain that in a little bit here. But we found many times with people that come in with a diagnosis of sports hernia that they actually get better if we treat it first from the spine and then get the hips involved a little bit more. Most of the current research shows that there's a lot of possibility of referral from the spine, whether you have spine pain or not. And we have to really get the hips working because the hips are the engine of the body. So the areas that I'm talking about here is, I'll see if I can pan this camera down so you can see what we're working with here. So I like to have people take their hand here and just slide their hand down, kind of like use the webbing, so they can butt up against like a bony crest. The bony crest here might be tender on some of you, okay? Even down here might be tender. But as we follow the fingers across and down, we'll end up right around the zippered line here, and there's a bone down right here. Just above the bone into the outer section here is the area where we're talking about the possible sports hernia diagnosis. Now, again, can it happen on both sides? Probably not. It's probably on one, but if you have both sides, you're probably wondering what could it be? Well, we got to start from the spine here. Again, there's stuff that wrapped around here. There's nerves that wrap around here. I can probably show you in a picture here. If I look off to the side, I'm sure I'll find one. I will show you here on this picture. Again, I might come back to this again just because I know you're here for sports hernia and you want to know about what to do about the tear of the abdominal area. But most of you, I'm going to say 9 out of 10 of you, especially if you're not really an athlete, you're just a weekend warrior, or you're somebody who's not really athletic at all, you probably have more of what I'm talking about here. And you've just been told that you have a sports hernia diagnosis. So if you look into here, you see some of the yellow areas, and there's these ones that come down here to the side. I mentioned there might be tenderness on some of you right around the flank here. And there's also ones that wrap around the belly area. These come from the higher areas of the spine, of the low back, like T12, L1, L2, which is a lot of times tender on people. So if you take your hands here onto your bones right here and you slide them up about kind of around here, so I guess there's about that far. That's around like L1, L2 area. And so what basically happens here is sometimes people are compressing little nerves there and they refer out into the groin area, simulating a sports hernia. Now, if you really truly do have a sports hernia, then you're looking at a tear of the area. A tear, a fraying of the, we call it the transversalis fascia. It's part of the abdominal wall. I would generally call this an abdominal insufficiency, meaning that it's insufficiently doing its job because I think the other areas are not really working well and the hip's not working well most of the time. Most of these overuse things tend to come from underutilization of other things. Make the other things work well so that those areas don't have to work so hard. Now, if you really truly did have a tear, there's a couple things associated with tears or large grade tears that you should be aware of. And this is just coming from a logical perspective here, and I've done multiple images on groin areas on people who think they have a sports hernia. We did it with an ultrasound, and most of the time you don't find it. But when you do find it, here's what I think you should probably find. Just think about what happened when you originally had this. Is number one, if you had a tear, like say if I tore my muscle right here, like I kind of stabbed it or nicked it away with, I landed on a sprinkler head, I'd probably have a positive image. I'd have a positive MRI, I'd probably have a positive ultrasound. It would see all the activity in the area. But if you don't see it, you probably don't have it. And it can certainly be referred. Now, the second thing is that you would probably have a mechanism of injury. You would have the thing that would create the possibility of having the tear, because tears just don't happen when you're sleeping. They happen with some type of mechanism, right? Throwing a ball, running, sprinting, stopping, changing direction, things like that. And so the change of direction mechanism, or a change of direction athlete, soccer, football, tennis, things of that nature, especially swinging and kicking sports, they have the mechanism where it would make sense. If you are a weightlifter, or you do CrossFit, or you are a runner, you don't really have the mechanism for this. Even I don't have the mechanism for this. Actually, I probably do. I play baseball on the weekends. But most people, general population with groin pain or sports hernia diagnosis, don't have the mechanism for this, meaning there's probably a reason for your problem. But the cool thing is that a lot of times, if we figure out what the body likes, if what reduces the person's pain, we can actually make them feel better very quickly. And the rehabilitation is usually stiffening the core and getting the hips to work better. And I won't go into this again today. There's other videos. I strongly encourage you to go through and watch them. But there are other things that be causing your groin pain, and I want you to just be aware of it. It doesn't mean you have to go and seek out if there's a confirming image for this thing. Because a lot of times people get stuck in this whole realm where they just keep looking for a confirmed diagnosis. And most of you aren't going to find one. Most of you do not have a positive image. You don't have a smoking gun, and there's no trauma. And so what happens here is a lot of times people spin their wheels, spend all their money looking for these images that will find, or exploratory surgeries that will find a problem, and you won't find it. What the cool thing is, though, is that many of you can start care. You can start rehabilitation if you just listen to what your body's saying and figure out if an activity is painful or not. No rehabilitation should be painful. This whole no pain, no gain thing is archaic. It's not real. It was back in the day. It doesn't happen anymore in the rehab world, okay? Obviously, things can be challenging, but they should not be painful. And so doing an exercise program, doing a rehabilitation program, a stretching program, whatever it might be, is actually advised to most people to start prior to actually confirming any diagnosis. We have a working diagnosis, and we also have a list of differentials. We have other things that it could possibly be. So I want to challenge you guys to really think about that, because when you are just waiting to figure out what your diagnosis is, you're not going to get anywhere in most cases. And you're just waiting and you're prolonging things and you're making it harder. Most of the time people can feel significantly better, reduce their symptoms within a couple weeks, and then start to build some work capacity back to really get back to the sport that they want to do if they have this problem with sports hernia. Okay? Other things that it could possibly be. It could be hip impingement, hip labral tears, and usually these are increased with deep squatting types of positions. Labral tear will usually have some type of painful clicking and clunking deep within the hip. It'll feel very much in the same area that we're talking about with the groin or with the sports hernia. Other times people will have low back stiffness, sometimes low back pain, past low back disc herniations, which can refer to the area too. You don't need to have spinal pain with it. But there's nerves, superficial nerves that can refer to the area, and we do have a couple videos that kind of confirms how we work with people with this type of thing as well. And so whatever you have, we can help you with, okay? Reach out to us for it. We'd love to help you out. Just email us or phone call. We invite people to have discussions about this on YouTube as well. That's fine. We might not see all the comments. That's just the way it happens. It's not like we get notifications when you guys comment, so we have to actively go down and dig, and we're trying to answer every question that comes on. But we have some other resources for you as well. And so the other resources, if we have it already created, it's going to pop up in the screen here really, really quickly. And I want you to get it. Most of the time we try to make them free, but there are some paid things along the path, such as seeing us in person or online, or even we have some video programs which are paid programs, okay? But we want to make sure that you get to the right care that you need, and it might not even be with us. And so the best thing you can do is reach out to us via email, set up a time, or just get the gift that we have available for you, okay? This is a long journey for a lot of people, and the reason is because they don't find the right type of care really quickly. They tend to do a lot of things on their own for a very long time, and it's challenging. The surgery is, from what I understand, it's not necessarily even paid for by insurance, and so you're going to spend some money somewhere, probably, okay? And so if you have questions, you want to get on the right path, just contact us. We'll do the best to send you to the right thing. And subscribe, like the channel, share this with a friend. Look out for the other videos on Sports Hernia coming up very soon. Take care.